Hi, everyone. I'm Dr. Bob Gabbay. I'm the Chief Scientific and Medical Officer for the American Diabetes Association, and it's my pleasure to be hosting my very first Ask Dr. Bob. This is where you get to send in questions to me, and I appreciate everyone that's already sent in questions, and I look to answer your questions. So without further ado, let's get started. Let me pick up the first question here. So somebody asked, there are a number of questions about insulin. And so one question is, what is fast-acting versus slow-acting insulin? Well, different insulins have different ways they work. Some get absorbed by the body right away. And those quick-acting insulins, those fast insulins, what they're really good for is helping after you've eaten something. If you think about what the body normally does, let's say for someone that doesn't have diabetes, whenever you eat carbohydrates, your pancreas and the beta cells of the pancreas, the ones that make insulin, they sense a rise in blood sugar and they release insulin right away. And so for people with diabetes who don't make enough insulin or don't make any insulin, and therefore need to take insulin, the fast-acting insulin is basically doing what the body would normally have done. It's a quick-release insulin. The slow insulin is trying to do, again, a natural thing that the body would do, and that's a background amount of insulin that's always present. Taking these long-acting insulin injections give you that standard long duration of insulin. So hopefully that explained fast and slow-acting insulin. Someone else asks about insulin, why take insulin automatically and maybe just watch the carbs? Well, here's where it's important to remember that there are two big types of insulin. Two big types of diabetes, type 1 and type 2. Type 1 is an autoimmune disease. The body attacks the cells that make insulin, and people over time make no more insulin. So they have to take insulin no matter what, because insulin is required to live. That's about 10% of people with diabetes have this type 1 form. Type 2 is the other 90% of people in the US, and they have a different issue. They have sort of two problems. Problem number one, they become resistant to the effects of this hormone insulin. And so what they have to do is make extra insulin to overcome that. And many people are just insulin resistant, and they're able to make plenty of insulin. And by doing that, they don't have diabetes. Their blood sugars are normal. Those people, over time, they may stop making enough insulin, and now they have the second problem. So problem one, resistant to insulin. Problem two, not able to make enough insulin. So now let me get back to the question so that it makes a bit more sense. And why take insulin automatically instead of doing something about watching carbohydrates? For people with type 1 diabetes, autoimmune disease, can't make insulin, that's not an option. They need to be replaced with insulin. For people with type 2, they may not make enough insulin, but if they eat fewer carbohydrates, if they particularly, most importantly, lose weight, losing weight makes the insulin work better. And they may be able to avoid taking insulin for some period of time. Okay, let's move to another one. Here's somebody that says, a lot of information has recently been revealed around COVID-19 vaccine. And what are the things that people with diabetes should know and be aware of as it relates to the vaccine? Well, first, let me share a couple of sobering facts about COVID-19 and diabetes. And I think this is the scariest one. is that if you look at all the people that unfortunately have died from COVID in the US, 40% of them have diabetes. So people with diabetes need to be extra careful. And that means washing your hands regularly, wearing a mask, socially or physically distancing from other people. I say physically distancing because socially we do want to stay connected. That's really important. That helps us live a healthier life. It helps our mental health and a number of things. So the vaccine, as many of you have heard, there was an announcement just a few days ago that one of the vaccines produced by Pfizer had very impressive results, and that's really exciting for all of us. We need to wait for the full results, but it was an early hint that maybe this is going to be a really viable vaccine. It's not approved yet by the FDA. It will go under very careful study to be sure that it's safe. But once we have a safe vaccine, we need to make sure, and this is something the American Diabetes Association is working really hard on, we want to make sure that people with diabetes are early in the line to get this vaccine because, as I said, 40% of the people that have died from COVID have diabetes. So it's important that we're at the front of the line, along with healthcare workers, to make sure that people with diabetes get vaccinated to prevent them from developing COVID. So we're excited about this possibility. Somebody else has asked, and I'm just going to keep moving on here. I've been prescribed Metformin, and so typically that's a medication that's used for people with type 2 diabetes. Remember, we talked about the difference. So I've been prescribed Metformin, and their question is, if I lose weight, can I stop taking it? Well, that's a great question. Weight loss makes your body more sensitive to insulin. And so it's possible by losing weight that the amount of insulin that somebody with type 2 diabetes makes may be enough, and they may not need any medication, and they may not need their Metformin. So weight loss is really important for people with type 2 diabetes, and they may be able to get off medication, particularly early in the disease. They can go into what we call a remission, where they still have diabetes because they need to be followed to make sure they don't develop complications of diabetes. But the really important part is that a little bit of weight loss can make a big difference. So you don't have to get to your ideal body weight. All you have to do is lose 5 or 10% of your body weight. So think about what your weight is, and 5 or 10% of that may be all that you need to be able to get a lot of the benefits of weight loss and potentially early in the course of disease, maybe even get off medications. But at a minimum, you'll be much, much healthier. After people have had diabetes for a long time, it's usually unlikely that they can get off their medications, even with weight loss. I will tell you, though, that another approach to weight loss is bariatric surgery that you've probably heard of. Surgery that leads to big weight loss, and those people sometimes and many times can get off not only medications, but many times insulin as well. Again, not everybody, but many times they can. And that's because not just the fact that they've lost weight, but there seems to be other hormones that change with this surgery that makes them maybe not need to take insulin. So it's something to talk about if you have obesity and need to lose a significant amount of weight. Surgery is an option to talk to your healthcare provider about. Okay, let me move on to another quick question. Let's see, we've got a number of those here. Are are there any resources or advice for managing reactive hypoglycemia? So let me just talk a little bit about this idea of reactive hypoglycemia. And usually what that term means, it's usually for people that don't have diabetes. And what they find, and many of you have probably experienced this, if you sort of have a real quick absorbing high sugar meal or high carbohydrate meal, the classic example might be pancakes with syrup. That really leads for everybody to a quick absorption of glucose, of blood sugar, and a quick spike. Some people, even without diabetes, after that quick spike, their blood sugars will drop quickly after that, and they'll start feeling the same symptoms of somebody that's had low blood sugars that have diabetes. They get shaky and sweaty. And that's sometimes called reactive. It's reacting to the high blood sugar, the quick drop. It's the speed of that drop that often causes those symptoms, reactive hypoglycemia. And so in those people, the way they can manage this many times is learning to eat the right foods to avoid that quick sugar rush up and that quick down. So having more fiber in their meals, having slower release glucose, a slower release carbohydrates. What is that? Whole grains, things of that sort are absorbed less quickly, and then see less of that dramatic drop in blood sugar and less of those reactive hypoglycemia symptoms. Let me check to see if we've got a couple of other questions here. A quick one just came in now. Is metformin dangerous? I'm glad you asked that question. So metformin is a drug that's been around for a long time, one of the longer standing drugs to treat diabetes since the 1950s. So why is there stuff about it being dangerous still coming up? It's really about specific batches, manufactured batches of a long-acting or a slow-release form of metformin. It's not all slow-release metformin. It's particular batches of it that have been found to have some impurities in it and therefore are being recalled. So it's not all metformin, it's really only those specific batches. And you should check with your pharmacist whether you may have one of those batches. The pharmacies have typically been reaching out to people to let them know. But if you're concerned, you could say, my last prescription, is this one of those that's been recalled? It's sort of like, we know that certain cars have been recalled. It doesn't mean that all cars are bad, but those particular cars or those specific batches of metformin have been a problem. So let me see, I may have time for one more sort of quick question. So here's one. I've been tested positive for COVID. Will the doctors give me antibiotics? So COVID, just as a reminder, is a virus. Antibiotics work on bacteria. So antibiotics would not work for COVID. There are some treatments that are being studied for COVID, and as they become available, we hope that they will help to deal with the disease. And in particular, again, this is something the American Diabetes Association is advocating for, is to make sure if there's a limited supply that people with diabetes, it's really important that they are near the front of the line for treatment. Looks like I have another question. Would one take metformin with insulin? Yes, sometimes that is used. Again, we're talking about people with type 2 diabetes. they get to a point where they don't make enough insulin. And so that's the reason they end up taking insulin. And metformin can help in terms of weight loss for people on insulin. So sometimes it is used with insulin for people to help manage their weight. And sometimes it can also, by making you more sensitive to the insulin you're injecting, you may not need as much insulin. Looks like we're getting a bunch of questions come in now, so that's great, and really excited to get these. Can untreated diabetes cause or make you feel like you have fibromyalgia symptoms? So fibromyalgia, for those of you, is often people have a lot of aches in different parts of their body. Sometimes they can have trigger points. And so the question is, can blood sugars being high really cause some of this? It's possible. What's happening when your blood sugar is really high, sugar is blood sugar, and glucose in particular is the fuel for your body. It's the main fuel of your brain, and it is what your muscles generally use as well for fuel. So when blood sugar and blood glucose is high, what's happening is those muscles are not getting that glucose. They're not getting that fuel. And because they don't get enough fuel, they can feel bad. And that bad feeling can be aches, pains, a variety of different things. And it's possible some of that could feel similar to fibromyalgia. The best way to know whether that's true or not is to manage your blood sugar, bring those blood sugars down with the right treatments that you talk about with your healthcare provider. And that will tell you, because those effects of high blood sugar that I was just describing really get better relatively quickly in a matter of days. And so if it got better, it was probably the high blood sugar. If it wasn't, and you still have this, then you probably want to investigate what the other causes might be. I want to thank you all for sending all the questions, and unfortunately we can't get to them all. The good news is that we'll do this again. And so thanks everybody for joining today. I hope you found this helpful. And on behalf of the American Diabetes Association and all of my professional colleagues, we're glad to be here for helping you. And until the next time when you can ask Dr. Bob. Thanks, everyone, and have a good day.